Okay, we're hearing noise. So if you hear, I could have said that for you. All right. So we will call this meeting of the Price County Health and Human Services Board meeting to order. I am Paula Hodak. I chair this committee. And at this time, could we please have the roll call, Meredith?
Good morning.
Good
Joe Baradka.
Here.
Paula Hodak.
Here.
Robert Kopish.
Here.
Patricia Stephen.
Here.
Dennis Wolfko. Are you online? Dennis? Okay, I do not have him as present.
Okay.
Nicole Kulwicki. Sally Hummel. Suzanne Acker, are you online?
Yes, I am.
Okay, thank
Hi,
you.
Susan. Yeah.
And Gerald Swenson.
Yeah.
Thank you.
Perfect. Well, good morning, everyone. First of all, we are going to start our public hearing. Public notice is hereby given to all people that a public hearing is being held at 9 a.m. on November 5th, 2025, for the purpose of entertaining questions and comments on the following: the 2026 Specialized Transportation Assistance Program for Counties, State Statute 85.21, Wisconsin statutes. This meeting will take place in the Courthouse County Boardroom 101. All people interested in presenting evidence are welcome to attend. Written comments sent to the county clerk and comments from the public in attendance will be heard. The 2026 draft application for State Statute 85.21 aid may be obtained from Price County Senior Services, 104 South Eider Avenue, Phillips, Wisconsin. Written comments should be sent to Price County Senior Services, P.O. Box 88, Phillips, Wisconsin, 54555. And will be accepted for the record until November 4th, which was yesterday. Transportation to be heard for the elderly and people with disabilities will be available. For more information, call Chris Mabey, our Senior Services Manager. So at this time, are there any public comments for the public hearing? Online? Nothing online, Nick? Okay. Seeing and hearing none, this public hearing is now adjourned. Going into the regular meeting, items for discussion and possible action. Is there any public comment at this time for anything on the agenda or off? Hearing and seeing none, we'll move to communications from anybody from the board. Any comments, concerns, communications? Hearing and seeing none, we'll move on to number 3. The vouchers have been passed around, I believe. I think we're kind of waiting to see if Dennis is here, but he's not here. We'll just pass it on. And okay, and then if you would pass them, Patty, if you would give them to Carrie right next to you there. Chrisanne is online. She's just not here. Yep, she'll do her thing. Yep. All right, and then we will come back to that for a motion. Let's go. Let's let her do her thing. Minutes from October 8th, 2025 meeting. What is your pleasure, board? Motion's made by Mr. Kopish and by Mr. Gerald Swenson. Happy birthday, by the way. Any comments, any discussion about the minutes? Okay, hearing and seeing none. All those in favor? Those opposed? Motion carried. Let's move right on to number 5, unless vouchers are ready. We probably could just do that. Mr. Kopish has given the thumbs up for the motion. That was a motion.
I believe he did have a question.
No questions? Oh, Chrisanne was waiting. There she is. Bob, no questions for her? Oh. You need a microphone.
I did send you a note.
Yep.
And I should remember this, but I don't. It's that Clark County, that elder abuse services. We had a couple. Is that, what are they doing for us?
Yep, that's a client that was protectively placed at the Clark County Rehab and Living Center in Owen. And we're
Okay.
paying that Medicaid rate of the $90 a day per the agreement. They were approved for family care, but Medicaid doesn't, or family care didn't get it backdated. So we just paid that $90 a day until they left until they were, approved for the date of the family care starting.
So they're not there anymore?
Correct.
Okay, so this is over with.
Yes.
Yeah, okay. And then I didn't put this in the note, but we had to still have those two high cost issues, the one with Lutheran Services and the one with Forward Home. That's the
Yes.
same stuff we've had going on. And
For the
that's,
child placement.
what's the estimate on when that's going to end, or is there no endpoint at this? That's going to keep going.
Yes,
Okay,
and it's been, we're kind of a little bit on hold right now with something going on.
We were losing some, but we were gaining some.
Yeah, we're losing 2, gaining 1, but
the total dollars seem to stay the same, about the same. Yeah,
going to, I believe.
yeah. Okay, thanks, Chrisanne.
You're welcome.
Any other questions for Chrisanne? Nice to have you on board up there, Chrisanne.
Kind of scary seeing myself up there.
Okay, I see none coming from the floor. So all those in favor of the motion to accept the minutes?
Excuse me, Paula. What was the second? This is Meredith. I got Kopish Bob for the motion. Who was the
Is
second?
that you, Gerald? Yeah.
Thanks, Gerald.
Mhm. For both of them, they got right in there. Thank you. So looking for that, the vote, all those in favor
Aye.
of the vouchers?
Aye.
All, I think we got, let's try it again. All those in favor?
Aye.
Thank you. Those opposed? Okay, motion said carried. Yes, we did the minutes and now we've done the vouchers. We just did them backwards. You look confused, Mr. Kopish. All right. It'll come back, right? Okay. Number 5 is the Public Health Unit, Tiffany Polachek and Susie Daniels. Let's see, we'll start with A, Partnership for Success Grant, Year 1. Susie Daniels, you are up. You are, just, you turn it on. You have to turn the little button that says on. Oh, push, that's right.
Gotcha.
There we
Thank
go.
you. Thank you. Good morning, everybody. And I'm Susie Daniels. Right now, I am working in the capacity of being leading the Strategic Prevention Framework Partnership for Success Grant. A little bit about this grant, and if we could go to the next slide, Nick. We were asked by Marshfield Clinic, Sanford Health, back in that daytime, it was Marshfield Clinic, to become part of this SAMHSA grant that dealt with underage drinking. When they approached us, my first question, of course, was, why price? And some of these are embedded right within the grant. Some of the answers I got was the 5 rural counties selected for this project are Barron, Forest, Oneida, Portage, and Price, which we not only exceed the national average on various data points regulating alcohol consumption, but we also exceed the state averages. Our median household income in each county that we mentioned above is far lower than the state average. Each county has substance misuse and mental health as our top health priority in our CHIP and CHA, our public health priorities. And the next one, Nick, is some of the comments are within the grant. They did some focus groups and they found that some of us were saying that it's just a way of life. Kids are often getting alcohol from their parents, and we're teens are a lot of time drinking right alongside their parents in bars. Price County is also designated as 100% rural and is designated both as a medically underserved area and a frontier and remote area. And in addition, kids are using alcohol to treat their anxiety and depression. And being in a rural area would pose a grave issue because our AODA treatment options are limited or non-existent. And also our mental health providers are very limited. So they answered my question, and throughout the grant, and I'd be happy, I think you guys probably, at the time we said we would be subcontractors of this grant, probably do have a copy of that. There's multiple other issues that we were named as a high-risk county. So we did take on this grant. It's a 5-year grant, and I'm just finishing up with the 1 year. And as part of my objective, I did say that after each year, I would like to report not only to my administration, but also to the health board. And maybe I'm working closely with the schools in regards to where I'm at with the grant. And if anyone can think of anyone else that would be interested in this information, I would be more than happy to provide this. Again, it's a 5-year grant. It goes through 2024 to 2029. I've already named the counties. And again, the focus is on underage drinking and mental health for youth ages 14 to 21. During that first year, I had a magnitude of activities I had to complete, a lot of training I completed. And I think the biggest thing is that we had to gather data that was specific to Price County in regards to supporting this grant. So I did a lot of data gathering and also had to end my year with an actual logic model which supported the grant. And I want to take you through that logic model. One of the things when I'm working with CATCA, which is the National Coalition Against Other Drugs and Alcohol, they like to make sure if you are identifying a problem, you have data to support each of those points. And I appreciate that, I guess. And finding that data was not hard for me in Price County. If we want to go on. Some of the activities that continued. Again, Marshfield Clinic has been an awesome partner. Their Center for Community Health Outreach, I cannot say enough about them as far as helping us through this process and being there for technical support, monthly check-ins, that type of thing. I've been working with them for multiple years now and awesome team. So continue. So the problem was youth are underage drinking in Price County. And we have found the data to support that. Our youth risk behavior survey in 2023 said our 9th through 12th graders in the past 30 days, 33% said they had had alcohol. This was the highest of the 5 counties. And 17% of the students in our youth risk behavior survey are reporting binge drinking. In April of 2025, I did a teen focus group. I had 19 to 20 freshmen through seniors, just kind of having a casual talk with them and asking them about their life and their alcohol ideas. And a lot of them were saying that it's just a regular part of our life, being a high school student. Go ahead. So we had to come up with a risk factor. What was the risk factor in Price County? Many things I could have said. Hey, it's socially available, it's socially acceptable. Our kids are treating their mental health issues, but we did decide it's just a community norm here in Price County. It's accepted. I did some key informant interviews with law enforcement in February, and it's February 2025. And again, their key law enforcement answers were, you know what, it's the culture of Wisconsin. And how many times have we heard that about Wisconsin? You know, Wisconsin drinks. Okay. I don't know if you remember, but we were part of an alcohol policy project, alcohol policies in rural counties and how they impact our behavior. We were part of that research, and we do have a recommendations were made to Price County in regards to how to follow up after that research. I can send that to you. I think Michelle did also. But within that research, we found that Price County is a local culture. There is a local culture where drinking is normalized. Alcohol is present at various community events and activities. And, go ahead, Nick. Binge or heavy drinking are considered socially acceptable, and stigma exists toward those that do not drink alcohol. Okay, continue. So what's my local condition? What did I figure out? And local condition is, what is something I could go in, take a picture and say, here's my local condition. And we know with my contact with our youth in Price County, youth are getting their alcohol from the homes, from siblings, and they're taking it to rural areas such as ice shacks, hunting cabins to drink. Okay. I did a teen focus group in May of 2025, asked that question. I said, where are you guys all getting your alcohol from? Siblings, they steal it from home. Big thing is fake IDs, and also friends that are legal. Okay. And I said, where do teens usually use the alcohol? Teen focus group again reported we use it in go to the hunting cabins, hunting shacks, our basements, secluded areas. And go ahead. So when you're working with CATCA, they always say that you have to have 5 or 7 areas that you have to identify and make strategies in order to really see community change. So I had to come up with those strategies. And what we did was, number 1, we want to, go ahead, Nick. We have to provide information. This is part of my strategy, is providing information to important stakeholders. There is a campaign called Not in My Home campaign. Some of you may remember those who host Lose the Most campaign. Educating those who are serving youth on the consequences. We also want to provide support, making sure the schools, ATV clubs, snowmobile clubs have information on the consequences of our youth using alcohol. There's a possibility I'm going to be providing liquor locks to some parents who may want them, also supporting our after school programs, and also partnering with the snowmobile and ATV safety classes on the providing information on the use of alcohol with ATVs and snowmobiles. We should always make sure there is some type of barrier. Fridge locks, tamper tape, be given to parents on some of our community fairs that we go to. Also educating on the consequences. If you buy alcohol for youth, what are the consequences? Potentially partnering with the law enforcement on extra party patrols, especially during prom and graduation time. We do have a billboards put up about the impact of alcohol on the youth brain. We want to make sure we do more things like that, light those areas up, making sure they're well seen. And then also we need to, go ahead. Get involved in policy. Presently, I have said we were going to extend the municipal inventory research that the researchers from Madison already have done with us. They did not finish the southern part of the county, so I'm going to be focusing on the southern part of the county and also working with key partners on social host ordinances. So through this whole thing, the dotted line was, I'm so aware of our youth and the crises they are facing in the area of mental health. And I think truly that many of our youth are using to deal with some of their anxiety and their depression. And so I would also like to try to focus on some of those things we can do on the tier 1 level, the prevention level, to make sure our teens are mentally healthy. I did a focus group and I asked the teens, why do kids use alcohol? It helps them run away from their problems. They get a sense of euphoria. We have bad home lives. We're depressed. We want to feel something. We want to feel anything. We want to get away from the world. And it's an amazing feeling when we drink. Okay. So one of the things the coalition has done is really united the schools and how we are facing some of these things. We do have a program called Sources of Strength. We have lifelines that the coalition has taken the schools and trained the entire 3 districts. We want to continue to unify them because our kids are so connected to each other. We want to make sure we bring stakeholders to the table and see how they can support us in youth mental health. Also, funding resources are very important. I did help Shawamigan write a small grant and Prentice write a small grant to also support Sources of Strength. It was for $1,000. But as you all know, school districts are very tight in their funding right now. So it was $1,000 well spent. And then I'm in the process of meeting with the counselors at the school individually to see how we can best support them in their kids' mental health. Any questions? Yeah. Hi, Brian.
Madam Chair, is it okay if I ask a question?
Go ahead, Mr. Ness.
I'm not going to make any friends here, but you said you're working with the school. Why is alcohol being served at the concession stand when there's a T-ball game going on
I don't know that, Brian.
or Little League?
Oh, I'm sorry. I like to walk. I'm sorry. I'm good.
To be perfectly transparent, I have bought beer at a game because I have grandkids in it.
Uh-huh.
But I think we're being hypocritical.
Yes. Well, I don't know if we'll, yes, exactly. We're being hypocritical. And those are some of the things that the policies need to look at. You know, why are we? I mean, school board or whoever, we need to look at, you know, we're definitely having evidence to say our kids are having problems and we need to be creating safe spaces. Is there a need to serve alcohol at a T-ball game?
Isn't it a drug-free, alcohol-free zone?
I thought that was.
Yeah. Mhm. Over at the ball field, isn't it? Oh,
That's city property.
Got
behind
it.
the
Mhm.
bus garage.
And, you know, and again, it's a big problem. It's a community norm. And to address this is going to take a village. And to take the numbers we don't like to see. You know, I don't like to see 33% of our kids saying, yeah, in the last 30 days I had a drink. You know, figure that out. We have what? How many kids in a school district? And 9th through 12th graders. So it's not a problem that's going to be solved in 5 years, I'm sure, but it's a problem that piece by piece, the stakeholders are definitely, hopefully will work together and you know, I look at some of those things and I want to go big. Okay, we got to do more. We got to do more. And everyone has to say, step back. We have to do just piece by piece and little by little, but every little thing. Hopefully next year I can come and say that the YRBS, the numbers are down 5%.
that'd be nice.
So, and that is my objective. Okay.
Mr. Brodka?
So is there any data
Mm-hmm.
from the past 30 years on how this trend has progressed? And I just asked that because like what Brian had mentioned about serving beer at the games.
Mhm.
And you had mentioned it in your presentation, funding. So everything revolves around funding
Mhm.
and also the culture. So how has the culture changed from when I was in high school in the 80s to now? And what did that progression do? Do we have that to show that?
Yes, we do. Yeah.
I'd like to see that.
Okay. And what we do also have, and we have to remember during that progression, I'm not sure, Mr. Braca, how old you are, but I'm going to date myself. You know, I was 18 and I could have a beer when I was a senior. You know, that was a big thing, is changing that drinking age made a difference. And I think, and I will get those numbers to you, but I think we probably saw a decline with that, just as we saw a decline in cigarette use. And we should follow the cigarette trend, I think. We saw a change in the age. We found that we limited those smoking in restaurants. You know, some of those things have helped in decreasing the amount of people using cigarettes, although now we have a vape crisis on our hands. So, yeah. Yeah, I will get those numbers. Thank you very much.
I think part of the problem can be also that we're fighting big businesses and their lobbyists, you know, so it's a generational thing, like you've pointed out, and everyone has known that since the day of dawn. So, but kudos to you for working so hard for that. And even just baby steps are always, if you can help someone or a
Yeah.
couple people.
Yeah.
Any other comments for Susie?
Susie, I have a question.
Yes.
I have oftentimes heard that, like you mentioned teens drinking with their parents in a bar, and that it's legal in Wisconsin. Do we know if that's a fact?
Yes, that's an awesome question, Nicole. Thank you. It's so funny you should say that because I sit with a guidance counselor that's from Illinois and a guidance counselor that's from Minnesota, and they came to Wisconsin and they went, what the heck? Is that true? And I asked that question to our alcohol policy project people just 2 weeks ago when I talked to them. And really, it's illegal. However, you know, we as a community could put ordinances in place saying that a parent cannot serve a child, or we could say a bartender cannot serve a child. We could make it part of the licensure system that says, you will enter this bar and the bar says, I'm going to be right out here on my license. I will not serve a minor. Yes, that does happen in Wisconsin, and it doesn't happen in many other states. But there are ways to get through that, and I'm hoping, you know, I don't know if I wanted to talk to the Tavern League. I know that they are going to be, but I think I have big shoulders. I have big shoulders, so I can probably address the Tavern League and, you know, discuss that with some of the municipalities also about putting that right within their licensures. Good question.
Thank you.
Mm-hmm.
You know, they also have that if the parent is serving their child or that
Mhm.
they're in charge of, and they get drunk in the bar, that's to a minor,
Yes. Yes.
delinquency to a minor,
Mm-hmm.
and they can arrest the parent.
Mm-hmm. Mm-hmm.
And that's been
Forever.
since I was a kid even,
Mm-hmm.
that if the kid got drunk, you're responsible for him,
Mm-hmm.
you're going to jail.
Mm-hmm. Or if that child got in a car and killed somebody.
Ah,
You know.
that's-
Yeah, well, that's a whole different.
That's a
ballgame.
whole, exactly. Yes. Yes.
Miss Steven.
Patricia.
You know, one of the things you're up against,
I know.
I just Googled out drinking your state. Wisconsin just popped up and you can buy t-shirts. You
Mhm.
can buy all kinds of clothes. But you walk into any tavern and it's on the wall somewhere.
Hmm.
That's
That's so funny, Patricia, because I walked into one of the gift stores this weekend that does T-shirts in Park Falls, and it's proud to be part of Wisconsin Drunkest State, you know, and it's right, and it's in a gift store that we, you know, so
yeah, it's
that is, I took a
we're-
picture of it, and we're going to put it as part of my,
yeah. So we're
PowerPoint.
bragging.
Yeah.
Or we're, you know, it's our
yes.
Mr. Kopish.
Yeah, Susie, are you planning on going forward with that ordinance?
I'm sorry, say
Planning on going forward with an ordinance on
You know,
the serving issue?
I would like to, what I would like to do is to start that process. I am pretty new to that, but I'm thinking through my municipal inventory. I want to start those pieces. I would like to know, have some guidance on who's my first person to look at as far as, okay, guys, I'm looking at changing an ordinance. Where do I start here? And if any of you know who I start with, let me know.
Probably.
It would be the
Um,
guidance of this board to
Mhm.
say, we want you to move forward with some type of ordinance. With that guidance, we would then begin to work on the process of developing an ordinance that would come here. We'd have a public hearing. We'd have legal would be involved to help
Mhm.
write it, make sure we have, you know, and some enforcement and blah, blah, blah. But really, it would be this board to guide you and Sarah and myself to begin a process to do
I mean,
such ordinance.
Yeah. And I know it appears to be, you know, a lot of work. However, and I'm willing to do those steps. And I'd be willing to get the guidance at the, in Madison from the State Alcohol Policy Project on to, you know, okay, guide this, help me to see these steps so I am doing this accurately. I know you guys know how to do it, but I want to make sure that I'm well aware in what their recommendations, the experts would say, and if we want to do this type of ordinance, how do we do it and do it right?
Yeah, we did that Delta 8, 9, and
Yes.
10 ordinance,
Mhm.
and we got some amount of pushback on it, but that kind of went away and it's in place. And
Mhm.
I would expect this is just going to really be a hot
Oh,
button.
yeah.
Yeah, I guess it would be. And
And we had differences of opinion among ourselves
Mhm.
on that one I just mentioned, and I mentioned it's the same thing's going to happen here.
Mhm. Mhm.
I grew up in Milwaukee and I was 21, but it never had a problem getting beer.
Mhm.
Never had a problem getting beer. And then you go to Madison, it was 18, Kenosha was 18. And not that we traveled
Mhm.
to drink,
Mhm.
but it was never a problem.
Mhm. Mhm. And access, social access is really a big risk factor. Community norm, there's just so many risk factors out there.
And that was a long time ago. So
Well, as you know, Susie, it's going to take a while.
It
Things-
will.
Those
Yes, it
wheels
will.
do turn,
Mhm.
so even working on an ordinance will take a
Mhm.
while to figure it all out.
Mhm. And again, I'm very willing to go step by step in very
Mm-hmm.
small pieces. And we don't want to put something garbage together.
No,
So,
no. And you want to have great statistics. you
and
know.
the important thing is to, again, I'm always bringing this down to our kids,
Oh,
that it's our kids. We're all seeing our kids.
Mr. Brodka.
Yes.
So another thing, if we're looking at possibly going down that road, a couple of things that just popped in my head
Mhm.
is, number one, is an individual that's under 21 still under that same law where the parents can have them drink with them in the bar? Because I've got a real hard time saying that an individual's up for hunting season with his family. He's in the military and he can't go have a beer with his dad. So
Mhm.
Okay.
all I'm saying is be really
Mhm.
cautious on how we
Mhm.
approach it,
Mhm.
in my opinion. So-
Mhm. I totally, and we all know.
And I know you will be. It's just something
Mhm.
that just
No,
popped
I
in my
get
head
it.
with hunting season here. So
Mhm.
Good call.
I-
Good call.
I'm a hometown girl, so I know all those things. Yeah. It's interesting. One more thing with that, Nicole, that you mentioned, once they turn 18 and you walk into a bar with your 20-year-old daughter, you cannot serve her because the parents no longer have guardianship over that 18-year-old.
Oh,
So there's a little twig in that thing. So you're 19 and 20, and I'm with my daughter. I cannot give her alcohol. I can give it to her if she's 16, but not 19 or 20.
Yeah.
So it doesn't make sense, does it? No, it doesn't. Thank you all for your time. I appreciate it. Thank you for everything you do.
Thank you, Susan.
Mhm.
Thank you much. All right, Tiffany, well water update from the DNR.
Hi. A while back we had talked about PFAS, and I just want to kind of circulate it back around. There was some testing that was completed through the emerging contaminant scientist with the UWC grant, and he's an investigator on one of the projects that was occurring here in Price County. It also included Rock County and Dodge County. So they were just looking at potential hotspots for PFAS. What they ended up doing is they sent letters out to some residents in our area offering PFAS testing. And we ended up getting, I don't know the total number. At one point, their goal was 40, and they had 20 respondents that did do testing. And out of those, they did find 2 of them that had high PFAS levels. So the update then went, the DNR then takes care of that portion of it. They have sent letters out with recommendations for those individuals in the county, and that included not to be using their water for drinking or preparing foods. They're also eligible to receive home bottled service water funded by the DNR for 6 months, and they were given information on how to contact Mr. William Roberts at the DNR for further follow-up. In the prior to August, I believe it was, there was funding through the DNR that could help with well replacement. And we actually had worked with the DNR a little bit on that because we actually had a couple residents that had high manganese levels. So I don't know where the funding is for that right now. I do have some emails out just inquiring on that. But as for now, I just wanted to update you that we did have 2 residents that did test positive or high levels of PFAS. So I did hand out just that informational sheet just so that everybody kind of knows what I'm talking about when I say PFAS.
Question on the manganese.
Yeah.
Is there an issue with manganese?
If it's above a certain level, I mean, you can have it where it's underneath I think I would have to go back and look, it might be under 300. But if it is high, it cause, neural, nervous system, brain concerns, and things like that. So,
Well, we have that.
Okay.
And I don't know what the level is though, but we can't use normal bleach because it puts orange spots in the
Okay.
clothes. So we have that in our water but I don't know if it's that high.
yeah.
I'm
And
gonna have
these,
to have
these
that
ones
checked.
were considerably high, the ones that we dealt with manganese. So
Yeah.
they actually had to, look at new wells. So
Huh. Okay.
if you want to share your results with me, I can let you know where they're at.
Have to
But
get a test.
after-
I don't have any accurate
Okay.
information.
Yeah.
I think we tested it a long time ago, but we haven't done it because it
Okay.
didn't seem to be an issue that way.
Yeah. Right.
But yeah,
Yeah.
okay.
And I could send you exactly what the numbers are, just so you have that for reference. So, any questions?
Any questions for Tiffany? No? Okay.
All right, thank you.
Tiffany. Number 6, Aging and Disability Senior Services Unit, Chris Maybe. You are up first with the 2026 application for 8521. Yeah. But we got that. Thank you. Mhm.
Okay, so you all should have received the 8521 grant. That is from the Department of Transportation. All the counties in Wisconsin are eligible to receive these grants. And ours is for $79,889. Yes,
So it's this packet,
yes.
thick
It's
packet.
big, thick one. Mhm.
So in there are the 4 projects that Price County has. It's the elderly, it's the Elderly and Disabled Transportation Program, the BART Bus Phillips, the BART Bus Park Falls, and the BART Bus Minocqua Woodruff route. And each of those projects lists out the expenditures and then the revenue that's comes in for those. These are all anticipated figures for 2026. So, and currently we have for the Elderly and Disabled Transportation Program, we have the 3 county vehicles and 6 volunteer drivers. Does anyone have any questions?
Any questions for Chris right now? Mr. Kopish?
Yeah, there's a lot of good information here.
Yeah, there is.
And that grant you were talking about, that's the sum of the funds from annual allocation. That's the total of that. We have funds coming from the municipalities. Where does that show up? Is that in here somewhere?
Yes, it's under the under the BART Phillips project number 2 and 3.
I was gonna ask that question too. Doesn't the county have a,
What?
Huh?
doesn't the county contribute also?
Yes.
Other funds?
It's just through the grant.
Right, so we use this grant to be like the
Oh.
local share. Phillips does 12,500, Park Falls does 12,500. Yesterday, we requested $1,500 from Fifield because they do a significant percentage of the rides up in the Park Falls area. We're going back to Fifield next, it's a Tuesday night, I think the 18th, or Tuesday morning, the 18th, to try to finalize some funding from Fifield. We are meeting with the Village of Butternut on the 12th at 6:30 p.m. to also request funding because they do quite a few rides up on that Park Falls bus. So yes, we put this grant towards it. We also use that those municipalities to complete that total cost.
And then just associated with that, I think the board approved helping to
Buses.
buy buses,
Yep.
but that's totally separate from this.
Correct. The buses are coming out of ARPA funding, and in the past they've come out of either this. We've had some reserves from this. Yep. So buses are separate from this.
So to answer your question, I believe, Mr. Kopish, on page 405.
Yep.
Okay, would be what you're looking for?
Well, yeah, I think I'm piecing it together,
funds.
looking at the other, and the county match is like 4 times 4, 16,000. Is that right? If I'm looking at that line right? County match funds? It's 39.95, 39.9.
Mhm.
Okay. And then passenger revenue, and then the other funds is quite a bit. There's a, what? $180,000, 190,000. That's coming from where?
That is BART,
Bart,
correct?
that's Bart's share.
Yeah.
That's all BART that's putting in? Okay.
So every dollar we match, they get at least $1, if not more, depending on if it's.
Okay, that's down below here too.
federal
So
or-
BART,
yeah.
yeah, okay, okay. Thank you.
Yeah.
Mm-hmm.
So what we're looking for is a motion on this, correct? To approve this and to let Chris send it on to the state.
I'd make that motion.
Motion by Mr. Baratka, second, Mr. Swenson. Any other questions or discussions? Hearing and seeing none, motion is carried. This will be sent on to the state, correct? And this does not go to county board. It stops here to go up to the state, just so you know.
Part
Okay.
that the county board approves is just the overall budget.
The overall
which
budget,
is-
right.
This is included in that.
Thank you for that. Okay, next one. Nice job on that, Chris. Award contract for nutrition program, RFP.
Help from
Chris?
Carrie? I had help from Carrie.
Oh,
on
and from Care, I'm sorry. Chris plus, obviously. I wouldn't be able to have all those numbers in my head either. You'd have to call on the numbers lady.
So the next one is the contract for the nutrition program. It was out for bid through the end of October. And we only received one bid for the program, for the nutrition program, which was the Phillips Cafe. So I guess we can award that today for 2026. The price came in at $5.45 a plate. So
What is that compared to last year?
right now we pay $5.30.
15-cent increase, okay.
And just for all of you to realize, this is a community business. When I ran the after-school program and the title program in the school district, we always had to have family involvement, and we always had dinners, play dates for parents to come in. They didn't have to worry about making supper. They would play games with their kids, do everything, and the meal was provided by the program, obviously through the state. But Phillips Cafe, I was paying $5. So just to show you, over those years, it's been many years since I've run that program. So I'd like to thank the Phillips Cafe and their staff for continuing to support the community. Next one.
Well, Chris, just a quickie.
Oh, I'm
Do you
sorry.
expect the contribution to go up at the meal sites? The Requested contribution?
That's actually on the Nutrition Advisory Council report that I'll be giving.
Okay,
Okay,
we'll get to
okay,
that.
so I'll wait.
All right, next.
Paula,
Paula.
quick question.
Yes.
Is there a motion needed for that one?
I don't think so.
No?
No, that was just an FYI.
Yeah.
Thank you for asking. No. Senior Services Quarterly Report, Chris?
Okay. So that should have been in your packet, I believe.
Here it is. It's this one.
Got it? There. Okay.
Okay, everyone has it? All right, Chris?
All right. So these were numbers from July, August, and September. The number of people that received home delivered meals were 76 total people. Number of inclusive meals served was 315. And the number of people that participated at the congregate site was 131 altogether. We served in those 3 months 2,826 home delivered meals and 1,830 congregate. I have the average number of meals provided for August and September on that, broken down by each site. Park Falls had an average of 44 meals per day in August, and September average of 43. Kennan being the lowest at an average of 8 per day. Transportation, we currently have 6 volunteer drivers, but only 3 of them are actively driving due to different reasons. So those 3 drivers are pretty busy right now. In those 3 months, they drove 6,416 miles and volunteered 229 hours of their time. I put information on here about the community outreach program coordinator, what she had been up to those 3 months. Strong Bodies information. The summer session ended. We're into the fall session right now, and that'll run to Thanksgiving. She oversees the Pleasant View Memorial Fund. Other health promotion information, she was trained in Mind Over Matter. The first workshop was held in October, and that workshop is designed for women over 60. We'll be offering the Eat Smart, Move More, Weigh Less program again, with another 8 spots purchased for that. We had Patriotic Music Bingo in July at different sites. August, Pictionary. In September, Kathy Shimkitz from NTC was in Ogama. And then there was a kind of a falls prevention video shown at the Normal Building with only 2 attendees. And Senior Living Expo, Teen Court, she's been busy with that as well. And that's about all for my quarterly report.
Do you want to just mention what is the presentation tomorrow?
So tomorrow, we have a gentleman coming from Madison, giving a presentation on the Edmund Fitzgerald. It was just another, Cheyenne coordinated it, and we thought we'd try to have it somewhere other than a dining site to see what our participation would be. And there's like 41 people signed up to come to the Normal Building tomorrow. So it should be, it's a lot for us to, yeah. So that'll be interesting. So
I just want to say, if you've not ever visited any of the nutritional sites, it's not just a matter of them coming there and eating. Sometimes there's a group of 4 men usually playing cards, some kind of card game. There are puzzles laid out in some of these rooms. There's just conversations that are going on. And this is really the whole thing that we wanted to do, is to bring people out of their homes and to have some social networking and keep those brains going, and of course, eating. So food always brings people in, which is always a good grab you. But it's all the other things, and Cheyenne is doing a great job, and the committee there too as well. So, Patty.
Is the SNAP program not funded right now?
I think we're going to have someone speak to that in a few minutes. So, okay.
Okay.
I got
All right.
a quick question.
And Mr. Ernst.
Park Falls and Phillips have basically similar populations. How come there's 3 times as many people attending the meals up there versus here? Is it because Mr. Kopish is there? Or?
I was going to say, it's the caliber of the people at the meal center.
Dave Schmidt.
You may not know the answer, but
I don't know. I'm not sure, you know. Yeah, we try and offer the same things at both sites that, you know, nothing seems to draw the Phillips folks in. So there is more of a group coming in to Phillips now. Last week there was larger groups there 3 days in a row. So I don't know. I think it's word of mouth there,
Mhm.
and that's how they're bringing more and more in.
And providing the activities. I think you've really ratcheted those up and things are coming in. So
Yeah, and on the Park Falls, a big portion of that number is home delivered. We have a lot of home delivered meals. I would say that's probably 30 to 35, somewhere in that range. So that kind of,
Yeah.
yeah, mitigates that a little bit.
Would it help to promote, like have a free meal for a couple or something like that? And would somebody that's kind of on the fence whether they want to go and eat every day, or it's just a promotional thing,
Right.
but it'd be, oh, hey, that was a pretty good meal. Maybe we'll try that. We'll try that one too.
Mm-hmm.
I don't know how that would work out. You'd have to figure that out, I guess.
Yeah. With funding, I'm not real sure that's the whole
That's what I'm
ticket
talking
there,
about.
right?
that's a tough one.
Mm-hmm.
Any other comments for the report? Let's move on to NAC update. Chris?
Okay. So we had the Nutrition Advisory Council meeting October 30th. It was at the Peace Center. We reviewed September meal site statistics. The members discussed the 2026 suggested meal contribution. And that will be going to the Council on Aging for final approval. They did want the home delivered meal increased by 1/4. But the Council on Aging will review that and then just make the final decision. Our Park Falls site sub, Nancy, has taken a different position within the county. But we were able to hire another sub for Park Falls. So she'll start next week, I think, just to train with Dawn. And then let me see here. Then there was a lot of, we reviewed the bylaws, and then there was a lot of comments from the individual sites, the representatives. The Brantwood meals have been good for the last 3 months. There was no complaints. Phillips, no complaints. Park Falls, overall, they were happy. Ogama just had a couple issues, and then Kennan had a lot. So, but yeah, otherwise it was good.
Any questions for Chris? Thank you, Chris. Nice job.
Thanks.
Economic support, Jenny Shu. I think this will answer some questions, hopefully, Gerald, from Jenny.
I think it was Patty.
Oh, that was Patty's question? Oh, okay.
So then, we did hand out the,
Turn on
Just turned it off.
and pull it towards you. Pull it towards you. It moves. There you go. No, do you see a green light? I thought it was, I must have hit it twice because I thought it was lit. There, I got it now. Okay. So then in the handout was the third quarter monthly estimates for the consortium and for Price County. Price County does stay pretty even, as far as the food share count. And I think it's just like because of what people in our county get paid. We have a lot of people that do have full-time jobs, but it's just the fact that those full-time jobs don't pay enough, they still are under the poverty limit for the food share program. So that just is a fact that
people just don't get paid enough. And so there are a lot of families that are on food share, a lot of elderly that are on food share for that same fact. Maybe you only get Social Security. Well, $1,200 a month is pretty tight to try to live on, to clothe yourself, to shelter yourself, to feed yourself. So the food share program does help fill that gap. And we do have quite a few in our county that are receiving those benefits. And then if you see the consortium-wide figures, we're looking at the counties that, the 10 counties that are with us. And so, of course, that's going to be quite a few. And Wood County is a high population, so that's where those higher figures come in. Did you have any questions about the quarterly estimates? Patty?
Okay. Back to senior dining, but the food SNAP has gone away. If someone just shows up at senior dining because they need food, do they need to prove anything, income, or can they just show up and say?
We order meals ahead of time, so there's only the meals that we've ordered, so we don't have any extra meals.
Okay. And then they say, okay, can I come back tomorrow? Someone,
They have to call in and they would tell them how they would need to do that.
okay.
And then it's just a donation.
That was my next question. If
The
they say I
donation, all
can only give
meals.
$1.
All meals, and nobody knows what you donate. There's a box there and you just put it in. So.
Okay, so
So-
that's available for a walk-in in a couple of days. We'll
As
get them.
long as they call the meal in.
Okay.
Because the day before, there's.
Yeah.
how they
Okay,
do it.
so it's
Yeah.
not like a week and they have to meet.
No.
No.
Okay, all right.
Yeah,
They plan on coming more than just that one day and maybe more. They got to make out that form.
Right, yeah.
It's just prove
But
that
I think
you're
it just tells
in
them,
it. Huh?
there's a form for home delivered. There's a form for home delivered to
Well,
make sure that they meet the criteria for that.
I think we made out a form that covered us going to eat at the site.
It was just probably demographics.
That could be, maybe we're just, yeah.
Maybe.
And I think there's a form of how things are going. We have that form too, of how the meals, how you rate them.
Is there a minimum age requirement?
Pardon?
Minimum age requirement?
Yeah, 60 and above. Otherwise, if it's under 60, the meals do cost like $17 because that's actually kind of what a meal costs when you include everything. So under 60, it's sort of $17 a meal.
Talk about the donation.
yeah, that's,
People do donate.
Well, you're right. There's some people that do donate extra. If a meal, they may put in $10. So there's other donations.
yeah, the 17 is full cost. That's full program cost.
Right.
Yeah.
I don't exactly.
Even though the meal
care.
is only $5 and
Maybe it's even
Just this
18
one.
something. Yeah, but it's around there. Yeah.
yeah. And what they want is they want you to call in by 10 o'clock in the evening by the day before.
It's the day before.
Yeah,
Yes,
we have a
'cause
little more
call-
latitude in Park Falls because Dawn checks at 7:15 in the morning. So sometimes people call in at 10 after.
Because they have to get everything prepared and.
And then she asks, like at the end of the week, what you want to do next week, that people that are regular, what days they want to sign up for. So they do that right at the site.
Yeah.
At least that's what happens in Park
I
Falls.
think that's, it's kind of. how
Probably the
each
same
site
thing
runs,
everywhere. Yeah.
right.
Just so she's got some idea whatever it is. So.
Yeah,
I-
this,
I know we did have a challenged person that he'd come in with his mother and he was probably 20, right in early 20s. So he always came to eat too. So I don't know how that worked, but
Yeah.
I don't know if
Yeah,
you
I
just
don't
have
know.
a thing for that or not.
Yeah, I don't know. Maybe he's paying the full meal and,
No.
yeah, I don't know.
because this just might add a person or two regular. They're on the fence maybe, and this might be what, the
I'm
family.
talking a
the
number of
family's
years
like,
ago.
okay, we're doing this.
Those are good questions. Anything for Jenny?
So there were just other,
For SNAP? No, yep.
yeah, there was
As
just a
far as the
couple.
court, yeah.
Yeah. Okay.
Mhm.
So then continuing on. Anyway, So just to let you know also that the clients did get somewhat of forewarning that the SNAP benefits were going to be delayed in November. And that one went out on October 21st. So people did kind of have a little bit of notice, which might have been somewhat helpful. We do have on the Northern Income Maintenance Consortium call center, there is information that is given to the people, letting them know that at this point, we don't know when the benefits are going to be released. If you're listening to the news, it's flopping back and forth. They're going to be released. They're going to be partial. They're not going to be at all. Okay, they're going to be partial again. So it's been flopping back and forth. And the latest that we've received is that they've okayed the partial November benefits, but they don't know when they're going to go out and if that might be stopped. So we're still sticking to the script for the clients, you know, just letting them know that when those are released, because if it ends up being a state from the state that they generate the payments, then they'll have to call the SNAP, the 877 food share line to find out how much is actually going to be in their account. Because that information is not going to match the information that we have, because ours show the full benefit for now. All those full benefits have been calculated based on their income, and they're in the system ready to go, but because there's no money there to release them, of course, and you all know that it's not being released at this time. And so the partial allowances, we're just waiting for some type of guidance on if they're going to be released, when they're going to be released. The first payment that didn't get transferred was on the 2nd of November. So people are already feeling it, because if you only got $24 in your account because you're a senior and you're getting $1,200 a month, that's, you know, that's a pinch, because if you're used to that, buying a few things with that $24, it's not there for them. It's not there for the families with the children. So it is very stressful right now for our clients as far as what's happening with that. On the call center, we are instructed to give the information on the United Way, which is the 211. 211 is funded through a mixed source of local and state funding, and it relies on the network of nonprofit organizations that raise money through various partnerships and they contribute to provide local assistance. So the 211 number is actually a 24/7 number that clients can call, and it's more than just food assistance. So if they need to put their food, you know, put their money into food, then they can sometimes help with like utility assistance, housing, elder care, crisis intervention, alcohol and other drug recovery, and much more. So this agency was created to gather all the resources at the local level for the state of Wisconsin. And they have 100% coverage of the state, and it's available by phone, text, chat, and online searches. So they do have a really nice website that you can actually pop in your zip code, and then it'll bring up what your resources are. But they are very helpful, and they are available 24/7. Does anybody have any? So that's basically what we're trying to like navigate those clients towards other sources that can help them to hopefully alleviate the cost of food. Maybe they can get utility help, and then they can use that for food. But as far as like when the SNAP funding is going to be released, it's anyone's guess. So they really haven't told us anything.
Nick?
Yeah, I just update from as a county as a whole. I've been on about a half a dozen calls with this WCA and other counties just to, okay, what's going on, what's happening amongst the counties. What we're seeing is a lot of community support is kind of the current, you know, the grassroots where churches, schools, whatever, are just putting together food drives to kind of offset some of that. They've advised us that if a county, there's I think one county right now that's trying to fund something and do something, there is no payback. So like if you choose to subsidize the federal monies to try to do something to in your community, there will not be a reimbursement when the funding or if the funding were to be released. They also talked about working with food shelters. We cannot directly donate to a food shelter. Some counties are working on figuring out if they can do a contracted service. So that's a different way of looking at it. But right now, the counties in general, from what we're hearing from legal, WCA, all that, is we're in a holding pattern to kind of see how this is going to move through this process.
They're just
Okay.
kind of making it community-wide to
Yep,
donate.
community
telling-
support,
yes.
lots of businesses coming together and just saying, okay, we'll be available. We have a spot to drop off food, a spot to pick up food. They're also seeing a increase in pets not being able to be fed because, again, however you want to look at it, when these funds aren't available, people need to shift other life costs to food to survive. So then we're seeing a higher shelter and access to those type of food, animal food. So again, we're following it at the state level, but there's not a lot as a county you can do besides support those community outreach type gathering of food.
Mr. Baratka.
So I don't know a whole lot about the SNAP program, but once an individual becomes approved for it, what is the process? So you talked about accounts and things like that. So what is the process once they're approved and the funding's been released? How does that work through to the person themselves to get the food? And I guess what's included in SNAP? Is it just food? Is it something else? Or is it, I guess, how does it work?
It's all food.
All food.
So
okay.
there is criteria at I think the only thing that's excluded is like hot deli. You have to purchase, you can purchase like a frozen chicken, but you can't go to a deli and purchase hot food.
Okay.
So that would be, but it's like all edible items, no soap products, no paper products. So it does have to be all edible items.
Okay. So that funds put into account that they have, I'm assuming they have a card. Is there a timeline that they have to use those funds by, or how does the program work once they have the funding in there?
So right now it's a little bit different. The funding will be available, like if they had anything left from October.
Yep.
Anything that was left on their card in October, they are able to use until it's gone.
So it
And-
doesn't sunset. Okay.
Right. Basically, if the count has no activity, like no benefits going in and no benefits going out for 365 days, they do get I think it's a 60-day notice that says that it's going to sunset. If you don't use this $50 that's been sitting here, you got 60 days to use it. Otherwise, it just gets returned back to the program. So they do take those funds out if there's no activity for 365 days. And it is just it's a swipe card that has a PIN number. So just like a debit card works the same way. And they just went to that in, well, I guess 2000 was a while ago.
Seems like yesterday.
Yeah. I don't know. Yeah.
Thank you for that information.
Oh, okay.
The one thing I find a little bit alarming to me is what Nick was talking about, where the community is going to come together and businesses are going to come together and help sustain these programs until they can get it wrapped around their heads in the feds. But my concern is, and we've seen that with other programs, is are they in the higher up going to say, well, the community came back and they're now taking care of it, so we could just pull away and let the community, not realizing how it can strap the community and businesses too. They're doing it to help their community at the time, but that's not really part of their business. So let's hope that doesn't become an issue as well.
And this is the first time in history, like from way back 60 years ago when they had paper coupons. When you came to your county office and you picked up your packet of paper coupons, that they've ever had a delay that they have not been funded. Yeah, immediately. So even at the last government shutdown, there must have been contingencies in place when there was that 30-day one. there were no, not even a question of any interruptions as far as, you know, when that last one happened. So
Right.
this is kind of a precedence on the times, I guess you just could say.
But it is kind of worrisome. Okay, anything else for Jenny? Nice job, Jenny. Thank you so much. Carrie, come on up. Oh, yeah, we didn't forget you. Thank you, Susie.
Okay, so there is the high cost placement reports. As I kind of previously touched on, we don't really see the children and youth going down, but more or less continuing on the same path a little bit that it's on. And then same with the behavioral health. That one is down a little bit from last year, but again, you can't predict humans.
Just humans, yep.
Any questions?
I'm not seeing anything. All right.
Thank you.
Thank you, Carrie. Director's report, Sarah.
Oops, that's fine. Our Birth to 3 program was audited in August, and we had 12 cases that were pulled, and we were in 100% in compliance. So that was good with all the cases that we have for Bobby Joe. It's actually excellent. Next thing is our Price County Senior Living Expo was a huge success, and I know Nick is just going to show some pictures, but I'm just going to give a little data on it. We had around 120 attendees. A total of 27 door prizes were given to community members who attended. Public Health gave 27 total shots and did 10 vital checks for the community members. The Substance Use and Mental Health Coalition gave away 35 Deterra bags, 7 medication lock boxes, 3 medication lock bags, and 12 Narcan overdose kits. Our dementia care specialist completed 1 memory screen the day of the event and was able to schedule 4 memory screens appointments, and received positive feedback from all the vendors regarding the benefit of this event for our community members. So it was just a really good success. I know a few of you guys were there to attend, and I don't know if anybody has any comments or feedback from the expo, but I know it was a huge success.
Yeah, I've got nothing but positive comments on it. Everybody was really impressed with the event. Happy that we had it. So.
And I believe the vendors as well didn't expect it. They were like blown away. So that's pretty cool. So, I mean, that just is kind of lights a fire under the gals saying, we can do this. So
hopefully next year we will look into doing this again. So
yeah, I actually learned something on the not the senior care, the family care issue. I thought Inclusa was the only option plus Iris, and I learned about My Choice, which
yes.
I didn't know people had that option. And the My Choice lady there didn't know some of the stuff that I knew because I was on that board for I don't know how many years. So I was going back and forth. It was kind of interesting. But
Good.
we have choices, which is good.
Well, thanks for attending. I appreciate that.
you're welcome. All right. So our next meeting date, I don't believe we'll have anything in December. If we do, we'll bring it back. But at this point, we just went right on to January. So the next meeting will be January 14th. And we're going to move into a closed session at this time.
So just as we go into that, so when we go into closed session, we'll be ending the recording and the meeting. Tiff and I are going to set up a second meeting so we're able to share stuff on. So it'll be a minute, but you guys have to do all your voting and your stuff. So as soon as we start, I'm going to be ending the meeting, and then we will not be coming back on the recording for those who are online.
Okay, announcement. Yes.
Do we have to let people?
Okay, when I'm finished.
Do we have to
Announcement.
let- Excuse me, do we have to let people know when we're coming back in session?
That's what we don't have to online because we're here. So that's why I'm just saying we're not coming back.
Okay, so we
Online.
don't have to give people to be able to hear
Yep.
us close the meeting or anything like
No,
that.
It'll
Okay,
just be
all
who
right.
would be in the room. Yeah.
Okay, all right.
Okay, announcement and motion to adjourn to closed session pursuant to the exemptions in Wisconsin.